Guys, I'll be explaining the liver anatomy. So before going to liver anatomy, you should have an idea about the regions of the abdomen, 9 regions of the abdomen. So first one is umbilicus region, which is present at the center. Next, above the stomach is the epigastric region. Epi means above. Hypogastric region is present below the stomach, below gastric region, hypogastric. Next comes hypochondriac. This is with respect to right as well as left side. Hypochondriac region, lumbar region as well as iliac region. We'll study about the planes, different planes. So this one is transpyloric plane. This one is transtubercular plane, right lateral plane as well as the left lateral plane. So as we have understood briefly about the basics of the abdomen, the different quadrants of the abdomen, we will see the anatomy of the liver. So what is the location of the liver in the abdomen? So we'll start from here. This is just for your knowledge. So this is the liver. Okay. Liver occupies right hypochondriac region, epigastric region, a bit of hypochondriac region as well as lumbar region. Very, very important. You can see most of the areas is occupied in the hypochondriac region, that also in the right hypochondriac region. So this is the location of the liver. So we'll see the detailed structure, shape, size, weight, everything about the liver. Now we'll look about the shape of the liver. So shape of the liver is wedge shaped. So shape is wedge shaped and it resembles to four-sided pyramid. It resembles to four-sided pyramid, and remember one thing, its base is directed towards the right and apex is directed towards the left. So remember these 4 points. This is the general explanation about the liver. Liver is wedge shaped, four-sided pyramid. Base is directed towards the right. Apex is directed towards the left. What is the weight of the liver? So weight of the liver in general, write it as 1.5 kg. 1.5 kg. If you want to explain briefly, then in male it is 1.4 to 1.8 kgs, and in female it is 1.2 to 1.4 kg. Next, so if we want to speak about the color of the liver, so color of the liver is reddish brown in color. So it is reddish brown in color. So this is the general basis of the liver. Now we'll look about the gesture of the liver. So how does this liver look like? So this is a liver. If this is a liver, there are two notches. As you can see, there are two notches. So remember one thing, the liver has two borders. The above part, this above part is superior border, and the below, which has notch, is inferior border. So the first notch is notch for ligamentum teres. Ligamentum first notch is for ligamentum teres. The second notch is for gallbladder. So the liver has two borders, superior border, inferior border. Inferior border has two notches. One notch is for ligamentum teres and the second notch is for the gallbladder. Now we'll see that the liver, if you imagine this as a 3D structure of the liver, so the liver has 5 surfaces. So see this diagram. Behind surface is the posterior surface. This is the superior surface. Green one is the inferior surface. brown one is the anterior surface, the front one is the anterior surface, and this part is the right lateral or right edge part. So posterior surface is the behind one, front one is the anterior surface, superior surface, inferior surface, and the lateral surface. So liver has 5 surfaces, which we have dealt about this. So liver has one prominent border, that is inferior border. So near this inferior surface you can see a prominent border here. So this is the prominent inferior border. So the inferior border of the liver has 2 notches, notch 1 and notch 2. One notch is for gallbladder and second notch is for ligamentum teres. So notch of gallbladder is also called as cystic notch, because cystic duct, cystic artery, everything is passing through this, whereas ligamentum teres is also called as interlobular notch. So there are 2 notches, one for gallbladder, one for ligamentum teres. We'll look about the classification of the lobes of the liver. So we have the liver. So liver is divided into 2 lobes. Liver is having 2 lobes, the right lobe as well as the left lobe. So the right lobe is further divided into 2 extra lobes. First one is caudate lobe and quadrate lobe. So caudate lobe as well as quadrate lobe. Right lobe is divided into caudate lobe as well as quadrate lobe. Now we look about the diagrammatic representation of the liver. If this is liver, there are 2 notches, superior border as well as inferior border. The 2 notches are ligamentum teres and notch for gallbladder. The liver is divided like this. So this is the left lobe and this is the right lobe. Left lobe as well as the right lobe. Left lobe is 1/6 of the liver as well as right lobe is 5/6 of the liver. So we'll look after the anterior view as well as posterior view. This is the anterior view of liver and this is the posterior view of the liver. Okay. If this is the liver, is here part notch for gallbladder and notch for ligamentum teres. So if there is ligamentum teres here, so there is a ligament present here and this ligamentum is called as falciform ligament. So very important part, falciform ligament is the one which is dividing the liver into left lobe as well as the right lobe. So falciform ligament is the one which is dividing the liver into left lobe as well as the right lobe. Now we look after the posterior view of the liver. This will be ulta. So if this is the posterior view of the liver, so there are 2 triangular ligaments. I'll explain it briefly. So this is the posterior view of the liver. So this part is called as ligamentum venosum. So now we studied about the 3 different ligaments: ligamentum teres, ligamentum venosum as well as falciform ligament. Now there are two triangular ligaments present on the posterior part of the liver. This is called as, this is the right side, sorry, this is the left side. It is the left triangular ligament. Here it is the right triangular ligament. So you can see a J-shaped structure here. You can see a J-shaped structure here. So this J-shaped structure is called as porta hepatis. Very important structure, and this is a very important question usually asked for 5 marks. So this J-shaped structure, which is the main gate, entry exit gate of the liver, is called as porta hepatis. Next, as usual, you can see the two notch. Since it is the posterior, this becomes the opposite. So this is a notch for ligamentum teres and this is a notch for gallbladder. You can see the two notches here, ligamentum teres as well as gallbladder. So I said in the right lobe there are two extra lobes, that is caudate lobe as well as the quadrate lobe. You can see it clearly here. So this is the caudate lobe. So this part is the caudate lobe and this part is the quadrate lobe. The another part is the quadrate lobe. So inferior border, two borders, gallbladder, ligamentum teres. Liver has two lobes, left lobe, right lobe. Right lobe has divided into two types, caudate lobe, quadrate lobe. Now we look after the anterior view, posterior view. Anterior view, there is a ligament which is dividing the liver into two lobes, right lobe, left lobe, by the falciform ligament. On the posterior view, there are two extra triangular ligaments, left and right triangular ligaments, ligamentum venosum as well as caudate lobe and quadrate lobe. Then comes the J-shaped structure. You can see the J-shaped structure called as porta hepatis, which acts as the main gate, main channel of the liver. In the next video, I'll be explaining briefly about the caudate lobe as well as the quadrate lobe. So if you like my channel, please do like, share, subscribe. Thank you.